very nice to be here today. I'm I'm a consultant of the Ministry of Health, and I'm part of the um, management of the Israeli Association of Allergy and Immunology. And some of my part is being the director of the personnel unit, the worker unit, health unit. So we already vaccinated about 10,000 people in Hadassah. And the main concern we see is the concern about allergy. So the vaccination, as I say to my patient, this is probably the best vaccine that ever been developed by human. Um, we need to explain our patient that every vaccine we ever produced is going through messenger RNA. For instance, viral plasmid vaccination, the old vaccination, all the vaccination needs to go through messenger RNA in order to make the protein the antigen protein, which means that in the previous vaccination we put the DNA or RNA or whatever it is inside a virus, a foreign virus, and the immune response was against the entire virus and our unique protein in the process. So this is not actually new. We are exposed to messenger RNA of every virus in order to produce protein. So here we have a very clean environment. We insert messenger RNA with a envelope of lipids, and it's going direct to muscle cells when we inject it into intramuscular, or to the regional lymph nodes in the muscle. Um, so as we understand, it is a totally foreign protein produced. The protein S is a totally foreign, which has many different epitopes, which mean that the British mutation or a variant would probably do nothing to the vaccine itself. So since it's foreign, and in order to have immediate type allergy or immediate type allergic response, we need repeated exposure. It's always like this. So if you're allergic to penicillin, you need to be exposed previously to penicillin, not in the same protocol, but years or months or earlier, in order to have repeated exposure. Here we don't have repeated exposures. So we don't have really an allergen. We have a foreign protein that is being constructed within the cell and exported outside the cell or on the surface. So we hardly see real allergic or severe real allergic responses. We have another problem, which is quite minor, with the preservant, the polyethylene glycol. Polyethylene glycol is a very weak allergen. Fortunately, we encounter PEG, polyethylene glycol, in many other products, many different medication like augmentin, antibiotics, or lactulose for diarrhea, and many cosmetics and preservative even in clinic um, products. So if one is allergic to PEG, he probably already knew it. So if you have a specific allergen you are known to have, you will not have a cross allergy response to this protein, which means if you're allergic to milk, you respond to drinking milk, but not to a foreign protein. So there were a lot of false rumors about allergic response in all the world. Very few real allergic response. We see minor allergic response in people that has a tendency to have like chronic urticaria or hives, which stress produce the urticaria, which is quite mild and it's self-resolving. You know that it's a stress response because the phenomena is self-limited within a few hours, and the allergen, supposed allergen, is already in the blood and will be there for about 48 hours until the messenger RNA will dissolve. So most of the responses we see are mild urticaria from atopic patients or very mild responses to polyethylene glycol. And most of the patient could easily get this vaccine. We injected like 10,000 vaccine in Hadassah, and we had only 3 or 4 minor responses, only hives. Stress make the patient feel that they have, yes, that they have.
This fits very well with the with the publication, I think, from the United States, where they had 170 occurrences and 1.8 million injections. Do you have already experience with a second injection?
Okay, we started yesterday, our second injections, and the only injection we see that are much harder are the inflammation response. You give a foreign protein, and the body responds to it as it is foreign. And by second exposure, you will probably have harsher inflammatory responses, which mean headaches, stomach aches, fever, myalgias, and stuff like this. But it will probably respond to a paracetamol or a dipyron, optalgine, or simple medications, and will resolve it within 48 hours since the messenger RNA is already not there, and the body like balances itself by itself. So people are afraid from the those response because they think it's allergic, but it is the normal process of vaccination, which induce inflammation and then memory T cells and memory of the vaccine, and which will probably last longer than we say today. Another thing we said that we are not sure that it's protect only the one that got vaccinated, but none of the vaccination we had used ever know how to immune the patient who received the vaccination, but not prevent him infecting others. So probably the vaccine is good for preventing infection as well. A few groups of patients need special consideration. One with peg allergy, of course, but also we take very extreme precautions, which are probably not needed, but we do it anyway, for people who had responses to a high variety of different medications, which we don't know for sure that it's not a different disease like a mast cell disease, which is a rare disease. So we take precautions. People that are having atopic tendency could respond due to stress or due to inflammation itself. Like post-viral atopic patient will have urticaria in much more prevalence than the normal population. So we can see some urticaria, but that's it.
How do you go about with patients who had COVID already? The Austrian suggestion in the moment, which might change, is to give the Pfizer to everyone, even though he had survived and had a status post COVID infection, which I do not really understand why this should be done in a situation of scarcity of Impfstoff, wie heißt das? Of the things to inject, of the
vaccine.
Yeah.
Why to vaccinate the people who've already had the disease?
Yeah, they suggest to vaccinate this, which goes against my feeling of being proper. First of all, because of scarcity, and the second, they came over it already. The only possibility is to have problems due to injection, due to the needle. And furthermore, if there's a reaction, it might be in those patients. How do you see that?
So I will try to comment about this. I'm a molecular biologist, and I think about mechanisms automatically. So probably those who got infected are vaccinated, and memory T cells are cured in large number of the population. Probably the vaccination of people that got sick is redundant. However, repeated infections promote immune response, more important for the coronavirus. So there is some kind of a hypothetical virus, coronavirus infection lasts longer than 48 hours, and it probably induced a better immune response than vaccine that is within 48 hours. So I think it's a waste of to inject those people who are probably immune as good as the vaccine patients, or even better.
Micha, if I remember well, you wanted to know about the logistics regarding the process of the vaccination, and I think Chava, you can probably help them with your experience of the last 3 weeks now, right?
Almost 4 weeks, yes.
Almost 4 weeks, because in Vienna they want to start this process tomorrow. Is that correct?
No, we started it last week.
Last week, okay.
We started last week in a pretty small pilot project, and we want to spread it out and do much more as of next week. And that's why it will be very kind and very good to hear some of your experience about it.
Okay, so first of all, to answer Dr. Seidler's question, we are not actively vaccinating people who have recovered from COVID, except for very few cases who've had their antibodies tested and have 0 antibodies, but are come in contact with COVID patients every day. For instance, certain nurses in the unit itself who work with the patients, then we will vaccinate them. But otherwise, we're not vaccinating people who've had the corona disease. As to logistics, we have been vaccinated over 9,000 people with the first vaccination. We do about 900 people a day. We work in one place. There are two to three different rooms inside the hospital where the vaccinating staff and some outside people. And the vaccine is delivered from the Ministry of Health to our pharmacy. And from that time on, we have about 5 days, sometimes a little bit less, to use the vaccines. So we try to figure out the exact amount that we need for the next few days. Once the vaccines are delivered to us, again, once they're out of the refrigerator or open, we have 6 hours to use it. Each vaccine bottle, 1 ampule, we're able to get 6 dosages out of it. In the beginning, Pfizer was talking about 5, but we discovered that with certain needles and syringes, don't ask me why exactly, but we're able to get 6 dosages out of it, 0.3 milligrams, 0.3 cc. As I said, usually we do not have a problem with keeping it for 6 hours. After 10 minutes, we're done with each vial, usually. As I said, we vaccinate about 900 people a day. With the first vaccine, the side effects that we've seen were pain in the arm, mostly, local pain and swelling. Few had slight or minor flu symptoms. As yesterday was the first day that we did the second vaccine, and now we're seeing more significant complaints of flu-like symptoms. People are complaining of fever, the chills, muscle pain, and headaches. We have this system that with the computer, go.
The
What are you going to ask?
Both were Pfizer?
Yes.
Yes. Israel just received the second shipment, the first shipment from Moderna, and I think the army is going to start using those. Right now, The civilian and hospital setting are using the Pfizer system. The fact that it doesn't have any preservatives is a limitation because once you open it, you have an X amount of time to use it. So it's a little bit stressful, but up till now, we have not thrown away one dosage. We've been able to give it out to anybody who needs it. We have a staff about between some shifts we have 6 nurses and some shifts down to 2, depending on the hours. But as I said, we're usually about 900 to 1,000 people a day. Any other questions?
The first thing is, do your patients who get vaccinated have to sign some kind of paper that they know what is going to happen to them?
So there is a standard form given out by the Ministry of Health asking a few basic questions. Are you over the age of 16? Have you been sick within the past, was it 2 days or 3 days with significant fever? In the beginning, we were not vaccinating pregnant or lactating nursing mothers. That changed within the first few days. And now there is an okay. And most of the women are being vaccinated. There's another question about allergies. And that's where actually the nurses who are supervising come in because their question, and thanks to Dr. Yuval, he's a phone call away. And anytime there's a question involving allergies, be it food, medication, or anybody with an EpiPen, we ask if it's okay we give them or do we refer them to the allergy center. We've definitely vaccinated, I think it's over 100 people who claim that they have an EpiPen. We keep them for supervision a little bit longer. Usually it's 15 minutes, but we supervise it for half an hour. And so far, so good. No fatalities.
Okay. The flow chart for 900 people, how many booths do you have where the people get vaccinated?
We have 2 rooms with 2 to 3 booths in each place. We have someone who makes sure the person is in the right room. We have a person who puts all the details into the computer because there's one standard database that's run from the Ministry of Health. And it has everybody's information in it. And then there's a nurse who actually vaccinates, informs the patient what the side effects, what to expect, what to that, and then we have them wait for 15 minutes with us. Again, it's the COVID, so we have to spread this out more than we normally would because we don't want too many people congregating in one room.
Are all the data of the patients from all the Kupot Cholim in one system? I understood that in Israel, most of the people are by Kupat Cholim being vaccinated. And then if they go to their Kupat Cholim, all the history, everything is inside. Now, how are you dealing with that?
The Ministry of Health has a computer program called Nachlieli. What they did is they opened it with a username to a lot of the health officials. So I can see into it, I can put data into it. Kupat Cholim can also put. Kupat Cholim is the health insurance for for all the patients in Israel. So they can access the same information. Now, someone informed me today that their doctor couldn't necessarily see that they were vaccinated, but she said he was looking in her file, not into the data system. So I can't answer that one yet.
You said that yesterday you started with the second vaccine, and it's been less than 48 hours, but you also said that there's more people that are complaining about being sore or any other or other side effects. What's the percentage of people that got already the second vaccine that complained about any side effect?
This is hazarding a guess. It's not statistically based but my guess would be right now from the amount we vaccinated, I think about 1,000 people between. Yesterday was a short day, today was a little bit longer. Less than 5%, my guess would be.
Okay.
But those who did complain did say that they definitely had a stronger, the symptoms are stronger this time.
Mhm. Okay.
Can I ask again about the structure? You have 2 rooms with 3 booths each, and the people stay inside this booth for 15 minutes?
There's the booth, but then there's a waiting, it's a big room.
Yeah.
So it's divided, and on one side we have all the computer systems in the nurses' booths, and then there's a big area with chairs. So half the room is divided for the people waiting for the vaccine, and then the other half is for the people after the vaccine. We have a crash cart with adrenaline prepared, not prepared, but there, and everything that the crash cart has in it. We have a bed in case we need it. But again, there's been a lot of, we've had 1 or 2 vasovagal things, but otherwise nothing significant.
Okay. How long
In the beginning,
how long are your shifts? How long do you let the people work within the booths?
some of them, we're working with volunteer nurses. You know, they come in from during their own shifts and where they work, a lot of it from the ambulatory area. So some of them give us a whole day, which is 8 hours. In the beginning, we were working from 6 in the morning to cover those from the night shifts till 6 in the evening to cover those from the morning and afternoon shifts. We're slowly cutting back because there's not much of a need for it. But the longest a nurse works is about 6 hours, and usually not. Usually it's 2 to 4 hours.
Okay.
Okay. Any other questions? Well, thank you very much. Yes, Micha.
Yeah, the preparing of the injection itself, you have to mix it. How are you dealing with it? Do you get it already mixed and it's being by in the pharmacy, or how do you deal with it?
It's one of the nurse's standards. If you're giving the medication, you have to prepare the medication unless done by the pharmacy. But this time, because once you mix it, it's only good for 6 hours, the nurses do it. But we have the refrigerators, which are, what's the word I want? Validated by the pharmacy, kept between 2 to 8 degrees, usually about 4 or 5 degrees. And we have a bunch of vials kept there. The nurses walks up, takes a vial, shakes it very, very gently, injects 1.8 cc gently, aspirates the air out, shakes it gently, writes the time on it, and then it's good for 6 dosages. But as I said, it's usually about 10 minutes worth, and then you're done.
Okay.
Great. Well, thank you very much, Dr. Yuval Tal and Chava Gardner. I really hope it helped you there in Vienna, and I wish you a very good process. And you know, we're here if you need any help. We'll be happy to help. I guess that there's going to be other questions during the process. We'll be very happy to stand by you. So thank you very much to all of you.
I would like also, Andy, if I may, I would like also to thank you all taking the time. I know it's not an easy time for none of us, but finding a few minutes is not always very easy. But really, thanks a lot. Behatzlacha to all of us, and let us hope that soon we won't talk about COVID anymore.
And hope to see you either in Jerusalem or in Vienna, whatever's sooner possible.
Yeah.
Amen.
You know, I think that if there's something that has proved itself in the Jewish people is that we have been there for every single Jew that needed help for many, many years in our history. So that's what we're doing now as well. You know, we have to help each other. We're part of the Jewish peoplehood, and it's a real pleasure to do, you know, a little thing that helps other Jews in the world. So thank you very much again. And Micha and Dr. Seidler, you know where to reach us. You know, if there's other questions, we'll be happy to
Thank you.
answer.
And if
Okay?
you are visiting Vienna, you are mostly welcome. We'll be delighted to host you here with us.
Thank you very much.
Thank
I'll be
you.
getting my second vaccine next week, so probably in February I'll be able to come and visit you.
Come and visit.
Thank you very much. Good evening.
Thank you. Thank
And
you.
לילה
בהצלחה
טוב.
with the vaccine process over there.
תודה רבה לכם.
ביי ביי, תודה רבה לכם.
לילה טוב.